Hey everybody, it's Dr. Tam here, your pain specialist and chiropractor here in Vacaville, California, where every single week I want to give you some tips on how you can really take great care of your body to have less pain, more function, and ultimately longevity. So, what is piriformis syndrome? I've heard things like, oh, it's the inflammation of the piriformis muscle. It is your sciatica, it causes sciatica, it causes lower back problems, the leg goes numb, right? So what is it really? We had a patient that went to a specialist, and the specialist told them that it was a pelvic floor problem. I said, holy moly, we are getting all kinds of stuff here in terms of diagnosis. Sometimes when you don't look at the whole body and when you only look at the area of pain, many times actually it can get misdiagnosed because they're not looking at the full picture. Piriformis syndrome, if you look it up, is defined as the inflammation of the piriformis muscle, and it can cause pain in your back, piriformis pain in your glutes on one side or the other. It may radiate to your hip. It can cause pain going down the back of your glutes, down into the back of your leg, all the way down to your hamstrings. Some people call it sciatica, right? So that term is thrown around as well. The word sciatica, I don't think a lot of people understands what sciatica is. Most people think that sciatica is a form of symptom, right? It's when it goes from the back of the glutes to your buttocks, down the leg. Oh, I have sciatica. And then their doctor tells them, oh, it's not your back, it's sciatica. Well, what does that actually mean? Most people don't understand what that means, right? So when they come into our office, they'll say, well, Dr. Tam, my doctor tells me I have piriformis syndrome or I have sciatica. And they themselves get really confused because they don't think it's the back, right? Or the fact that, oh, I never hurt I don't know what happened. I just started getting sciatica. I'll tell you this. No one just randomly starts getting sciatica. Sciatica is not one of those things that just pops up out of nowhere and all of a sudden you have it, right? And piriformis syndrome is the same thing. Same thing with numbness going down the legs, okay? You might initially get some form of tingling, numbness, or pain. It may go away, and that might happen for years. You might overdo it one day and it catches. You might be sitting too long one day, standing too long one day, and it gets worse, right? And it might start off once in a while, and eventually it becomes a daily thing. So the piriformis, when you look at where the piriformis muscle attaches to, it's attached to the pelvis, right? So you don't just wake up once again with sciatica or piriformis syndrome. It's usually due to a misalignment of the pelvis and the hip. Now, could it be caused from multiple things? Of course, because it's not just always the muscle, right? The only time a muscle is the cause of the problem is usually when you have injured that muscle, like you cause a contusion, which means, like, say you're walking around, you slip and you fell and you land directly on that muscle. Okay, you had a muscle injury. You injured that muscle. You strained it, you sprained it, right? You strain because strain is tendon and muscle, sprain is ligaments. So you strained it. Maybe you contused it or you bruised it, right? There's trauma to the muscle, and now that muscle is inflamed, it's damaged. So now you truly have piriformis syndrome, okay? Because it's coming from that muscle. If it's not coming from that muscle, you can't say that it's caused from the piriformis, right? Most of the time, people have piriformis syndrome, okay, an inflamed piriformis. It is due to a misalignment of their pelvis. The pelvis has a minimum of 3 parts, okay? You have your sacrum, you have your ilium on the left and right side, right? And then you also have your femur attached to it. Some people call that part of the pelvis as well, or at least you see that in pelvic pictures. But that's not really part of the pelvis. So the pelvis has 3 pieces of bones, at least when we're an adult. When we're younger, the sacrum is separated, our tailbone is separated into 5 bones. Some people have 6. So when you look at it, something is not right with the pelvic area. It could be the ilium, which is the 2 bones on the side. It could be your tailbone, right? And because of misalignment to that area, now it's inflaming the piriformis. Very similar to if your car was out of alignment and you end up with a wobbly tire. I have a wobbly tire. You go in and see the mechanic, and the mechanic says, "Oh, you have a wobbly tire syndrome." What? That doesn't make sense, does it? It's not because of your wobbly tire that's the problem. It's because, well, let's just say it's a wobbly tire problem, right? And they fix the wobbly tire. They just pop a new tire back in, and maybe it fixed it for a while, right? That's very similar to, let's massage the piriformis. Let's massage it, let's ice it, let's treat it, put creams on it, put some potion and lotion on it, and ooh, your piriformis is gonna feel so much better. That's like putting a new tire on. But what happens after a while, right? If you don't fix the alignment of your pelvis or of your car? Oh no, you got the wobbly tire syndrome again, right? And it happens over and over and over again. And eventually you have chronic wobbly tire syndrome, just like chronic piriformis syndrome, right? It's because you never fixed the original problem. So I want you to look at this. Look at the body in this way. Instead of a muscle problem, look at the joints around it, because muscles attach from one bone to the next, okay? And that's why we have muscles, right? Muscles causes movement in the body, okay? And in order to cause movement in the body, it attaches from one part of the body to the other part. And an inflammation of that muscle by itself doesn't get inflamed for no reason, right? It's due to a compensation of something. So you really need to find someone who understands how the body works. If you go to a pelvic specialist and they just look at the pelvic floor, right? They look at the muscles, they look at the nerves. Well, they never looked at the alignment of the pelvis, right? It's like if you went to a mechanic and you went to a tire specialist, and if they don't know about alignment, maybe they don't do realignment, right? And now they're looking at the tire. Is it the rim? Is it the wheel? What is it, right? So you have to look at everything as a whole, not just pieces of the body put together. It's the whole body put together. That's what makes our body work, right? And sciatica is the same way. Sometimes those terms get thrown around, oh, it's your inflammation of the piriformis. Oh, it's your sciatica. Well, what is sciatica really? That could be a whole nother video, right? I'll tell you about it. Sciatica, the term sciatica is, used when someone inflames the sciatic nerve. Well, the question becomes, why is the sciatic nerve inflamed? Could it be if your sciatic nerve, some people's sciatic nerve runs through the piriformis syndrome, A misalignment in the pelvis causes an inflammation of the piriformis, which then irritates the sciatic nerve, and now you have sciatica. Or is it that there is a pinched nerve in your back causing the pinched nerve at L4, L3, or L5, causing pain going down the leg that wraps around the front of your leg down your calves, right? Or the back of your leg and down your calves and into your first, second, or big and third toe. So it could be multiple things that can cause sciatica as well. How do you differentiate whether it's, number one, is it a pinched nerve? Is it a misalignment? Is it a disc problem? Is it a pelvic problem, right? And how do you know which one it is? And then how do you fix it? See, it's not just a patch. So many patients come to us and they told us that their doctor said, oh, I need to take this medication for it. Or they gave me this medication, now I have to exercise it, right? After I exercise it, now they said it doesn't work. So I have to get a cortisone shot, maybe an epidural into that area. And years of that goes by and Dr. Tam, it still doesn't work. And they want to suggest surgery. Well, I don't want surgery, so I'm here. And you know, people suffer for many, many years and they don't understand because they never went to a specialist that looks at the whole picture, who understands what piriformis syndrome is versus a pinched nerve versus a disc problem versus sciatica. You know, so you really need to have someone in your life, a doctor in your life, whether it's us if you live in the area, whether it's somewhere else, who understands the difference between what each of those things are, because it could be any 4 or 5 or more, right? I'm just naming off the top 4 or 5 problems that can cause these symptoms. Very similar to when you go to a dentist. Oh, my teeth hurts, right? My tooth hurts. Is it a cavity? Do you need, is it a nerve irritation? Do you have TMJ? Is it an infection, right? Do you have a tooth rotting, right? Is it a misalignment of your jaw or teeth? That's 6 things right there. But all you go in with is you have pain, or you think you have TMJ. Oh, it's my TMJ, right? What's causing that to begin with? So a good doctor will really sit down and diagnose the problem, not just look at or hear you talk about it and then say, oh, maybe it's that. Let's throw this at it, right? It's not going to fix anything, okay? Because pain in your body is not due to a lack of medication, right? I promise you that. I promise you our body's not made to need medication in our lives in order to fix a problem, okay? So let's find out what it really is. If you have a problem, we need to get to the bottom of it to see what it is. And once we get to the bottom of it, well, how are we going to fix it, right? So until next time, I hope this really opens up your mind about what could certain problems be, and really encourage your own doctor to be very proactive. I encourage all of our patients to be very proactive in taking care of their health. Okay? Until next time, have a great day.